Welcome to Kular Hospital, Kular Bariatrics and Metabolic Surgery Department. I am Dr. Kular and we'll discuss about mini gastric bypass and the weight loss, how much weight will be lost and how to sustain the lost weight. Mini gastric bypass is basically a strong procedure. We should not take it as a mini bypass. It can be as strong as any other procedure because there are two components. One is the restriction. As you can see in the picture, we reduce the stomach to the size of a small long tube, and then we do the bypass along with that so that your body absorbs less. So eventually, after mini gastric bypass, what will happen? You will be eating less, but a moderate amount of diet, and you will be absorbing less because the first part of the intestine has been bypassed, and this bypass can be tailored according to the patient. If you want to lose like 100 kilos, 200 pounds, 300 pounds, we can do a longer bypass. If you want to lose less, we can do a smaller bypass. So the beauty of the mini gastric bypass is that it can be tailored according to the patient. And in one line, if we need to understand how the weight loss will go, mini gastric bypass will make you the master of your weight. But you need to keep your weight, your obesity, your slave actually, so that you are the master. And how to do that? Initially, about 70 to 80% of the required weight loss will be given by the procedure itself without much effort from your side. Because I see most of the patients are not doing exercise. They just walk or do a little bit of exercise. They are not used to it, but still they are very happy about 80% of weight is lost if we do the surgery in a classical Rutledge manner. If you want to be perfect, then 15 to 20% part has to come from your side. Watch your calories, don't take too much of sugars, don't take too much of alcohol. You have to live like a normal person. And going by this, if you follow this, initially in the first month, on an average, we expect 6 to 8 kilos of weight loss, but lighter patients will lose less, and heavier patients, like if someone is like 400 pounds, 500 pounds, might lose even more, like 10, 20 kilos also in 1 month, in the first month, because 70 to 80% of the weight loss in the first month will come from the water loss because your body had retained a lot of water and that gets out of the body. And in the next month, and gradually the curve will slow down, and eventually in a matter of about an year, this curve will flatten and it will look like you are not losing any more weight, and you will see some plateaus also, like for 15-20 days no weight loss, then some weight loss like 3-4 pounds, and again it stabilizes, again it goes down. And in most of the cases, still patients will see some weight loss up to 2 years and sometimes even more. So your body will gradually adapt, and at one point you will stop losing more weight, and after that in the next year you might also gain 8 to 10 pounds, and this is the natural behavior. And then you have to maintain the lost weight, and that is very easy because this surgery is like a power steering. It gives you the power to drive your body to keep your weight under control. So just watch sugars and cold drinks or empty calories, and do some moderate exercise like 20 to 30 minutes, maybe jogging or brisk walk, and this should be enough for you to maintain your weight, and your body will be just like any other normal human being who can maintain the lost weight with just a moderate amount of effort. Thank you very much.